Hello everyone. This is part 2 of what physicians tell us they want to know about disability insurance planning. Today we will have a high-level examination of employer-provided disability insurance policies. I'm your host again, George Davidson of Secura Consultants in Minneapolis. If you have any questions or for more information, please go to www.gmedisabilityplan.com. Our agenda is a lot like part 1. We will have about 15 to 20 minutes of information, and then I will again share some information on a special disability insurance plan for residents and fellows, in training at the Mayo Clinic. So what is employer-provided disability insurance? Very simply, it's the insurance that's provided to you by a clinic, a hospital, or any other place that you work. It's always important that you get a complete summary plan description, or SPD, when you join your new employer. Do not, I repeat, do not only get the certificate they may provide you, or flyers, or any other summary of coverage. You should always ask for the full summary plan description. There are a lot of other things you need to consider. These plans may be made up of group long-term disability insurance or individual policies, or a combination of the two. There are many provisions you should be aware of. Our first webinar discussed individual disability policies, so we're going to spend our time today on group long-term disability insurance. Again, we have a lot to cover. We will only be able to broadly address some of the big points. You need to know there's a lot more you should understand, so please get those summary plan descriptions and spend a little time reviewing them. First of all, it's important to understand that disability insurance that's provided through a group disability insurance policy is designed for the masses. You as a physician may be in a different class of coverage, but you are just as likely not to be. And this is extremely important that you understand this. The plan is designed by and for the employer, and the employer owns this plan. You do not. It is not portable like your health insurance might be through COBRA. There may be some conversion opportunities, but they are typically very limited. So again, remember, the employer owns this. It's designed to meet their needs and objectives, and those needs and objectives may not coincide with yours. The other issue that's important to know is most human resource managers have a very shallow depth of knowledge in this area. They spend their time on other issues, and typically choices are often presented by employee benefit specialists, and decisions are made by the human resource managers solely based on price, with little understanding of the impact of their decisions. Lastly, there are enormous variations, and we'll touch on that through some of the material. But this is not a fixed product like an individual disability insurance policy. Therefore, policies offered by the same insurance company can be enormously different. So please be aware of that, and make sure you're reading those summary plan descriptions. So like we did in the first webinar, we're going to take 6 subjects and spend some time with them, and I'll try to go quickly so we don't overstay our welcome. We're going to start with definitions, and there are many definitions in these policies that are important that you understand, but we're going to attack 2 of the biggest, which are the definition of disability and the definition of an occupation. And it's important that you understand that inside a group long-term disability plan, this definition of disability and definition of occupation typically are tied together. It's kind of like peanut butter and chocolate. They go together. And you need to be aware when you're looking at these summary plan descriptions that the terminology may change over a period of time during your claim. So for instance, you may have a really good combination of definitions for your first 24 months of claim, and then it changes dramatically and is not as favorable to you after that. So look for that in your contracts as you go out and accept positions at hospitals or clinics or what have you. So here's an example. This is an own occupation definition of disability. That's what everyone's told to look for. And this is from the same insurance company. So these are two different variations from the same insurance company. The very top example is number 1, and it will be in the subsequent slides we'll look at. Notice, if you will, and I'll try to use a highlighter here to get some emphasis on this. Notice, if you will, that the definition of disability here says you are unable to perform with reasonable continuity. Oh, afraid my highlighter's not working. I apologize. So if you look at number 1 and 2 in the top example, it says you're unable to perform with reasonable continuity the material duties of your own occupation, and you suffer a loss of at least 20% of your earnings. If you look in number 2, which is the exact same company, it states that you are disabled if during the benefit waiting period and the duration of the benefit, you're unable to do the material duties of your occupation and there is no earnings loss required. Now, this can be extremely important. Let's say that you work in an environment where you have performance income or receivables, and your employment contract allows for those to be paid to you even after you've stopped working due to an illness or an accident. This would affect your ability to satisfy the definition in number 1, but would not in number 2. So these words are extremely important. Let's look at definition of occupation. In the first example, you're going to see own occupation means essentially the profession that you are engaged in at the time of claim. So of course that's not such a bad definition. However, if you notice at the bottom of this, it says if your own occupation involves the rendering of professional services and you are required to have a professional or occupational license, your occupation is as broad as the scope of your license. Okay? You're a physician. You have to have a license, and so therefore this would apply to you. So if you're a surgeon and you're doing a specialized form of surgery and you develop a palsy or some form of a condition where you can't perform surgery, but you can practice consultation, internal medicine, what have you, you're not disabled under number 1. But number 2, you'll note that about halfway through, you'll see that it states that if your occupation is limited to the practice for which there's a specialty or subspecialty, then that is your occupation, as long as that has provided you with at least 60% of your gross professional service fees or income. So again, there's a myriad of variations, but obviously in this situation, number 2 is a much stronger definition than number 1. So now you need to think about covered earnings. What, in fact, is protected? Physicians receive compensation in many different ways. You have salary, you have production bonuses, you have distributions, pension profit sharing contributions, a variety of ways that you'll be compensated as you practice. But what does your policy cover? All of this or some of this is important for you to know. So this is a great example. In number 1, you'll see this definition. In the second sentence, it says basic wage does not include commissions, bonuses, and I won't read the rest of that for the sake of time. But the point being is bonuses are a significant contributor to income for most physicians. You'll see in number 2, this definition actually does cover bonuses. So if you're a physician where you have income of salary and then production income, and let's say that it encompasses half of your earnings, both of those variations, your disability plan under number 1 only covers salary, your disability plan under number 2 covers both. And when do you want to know this? Before you're sick or hurt or after? How do you qualify for benefits? There are many different provisions that you need to be aware of dealing with qualification, but one that we're going to talk about, which is a stumbling block for many physician claims, relates to the beginning of the claim and the situation we see all the time with a highly motivated physician that's dedicated to the practice, dedicated to the patients, and trying to fight through the effects of an illness or injury and get back to work. So in this scenario, if you look at number 1, you have periods of temporary recovery during this elimination or waiting period for up to 30 days. So if you're in treatment and you miss a month of work and you start feeling better and you try to come back and you return to work for 29 days and then you suffer a relapse and you go back out due to the same cause, you don't have to start a new waiting period. If you look at number 2, you only have 15 days. In that same scenario, you would have to start a new elimination period because you were back to work for more than 15 working days. You have many policies that require consecutive days and allow you no ability to return to work. This is important for you to know so you can manage your sickness or your injury and your return to work so that it doesn't negatively impact you just because you're trying to do the right thing. Another situation are pre-existing condition limitations. And the one thing you need to realize is that the day you leave training until you qualify for your new employer's plan, if you haven't purchased your own coverage, you are completely exposed. Most employers require a period of work before you're eligible for benefits. This could be 90 days, it could be 180 days, and then if you have any pre-existing conditions, you may not be covered for those. So you may end up with a significant exposure well into your career with your employer if you're not aware of this issue. So here's an example. In number 1, a pre-existing condition is any condition that you've received medical treatment, consultation, care services, diagnostic procedures, been on prescribed drugs or medicines during the first 12 months immediately prior to your effective date of insurance. In number 2, that period of time is only 3 months. However, in both of these examples, you're not covered for that pre-existing condition until you've been working at your employer for over 12 months, and the disability begins after that period of time. Some plans and pre-existing condition plans will exclude all disabilities until you are symptom or treatment free for a period of time. And if you have a chronic condition, you may never be symptom and treatment free. So keep that in mind. Another, what I think to be an insidious provision in many policies that human resource people choose in order to save premium, and typically a fair amount of premium, is something that we call a special condition limitation. These are typically high claim instance illnesses or injuries where patient complaint and or subjective medical evidence is the only proof being offered of this disability. So what are examples of these? And I know this may be difficult for you to see, but this is actually taken from a policy and very typical for these pre-existing condition or excuse me, special condition limitations that may be found in a policy. And what you'll see is that there'll be things like connective tissue diseases, soft tissue injuries or complaints, chronic fatigue, chronic pain, reflux, headache, which would include migraine, irritable bowel syndrome. I mean, a whole host of issues that would create real challenges for you to be able to work, and any benefits under your employer-provided policy would be limited to 24 months, and typically that's 24 months through the lifetime of that contract. So this is a very significant limitation you need to be aware of and look for in your employer-provided policies. Now, this next point I do not have nearly enough time to cover. This is a very deep subject. Many attorneys do nothing but handle ERISA issues, and ERISA is the Employee Retirement Income Security Act of 1974. Essentially, what ERISA has done is to create an environment where the remedies of the insured in an employer-provided plan are limited. There is a procedure that is very stringent and difficult to follow that you must follow during the course of a claim if your claim is being contested by the insurance company. You as a claimant do not have the right to sue or to seek benefits when there has been some form of egregious act, bad faith in the settlement of your claim. There is, again, a significant amount of information on this issue. It impacts physicians in employer-provided plans all the time due to the significant amount of these claim benefits. It really creates an environment where when there's not clear evidence of a claim, or if the insurance company feels they want to resist that claim, it limits their downside exposure to do so. So if you want to learn more about this particular issue, again, please go to www.gmedisabilityplan.com and submit an inquiry, and we'll get you additional information on this important issue. Okay, we've been about 15 minutes now, so I'm going to give you some information regarding a special graduate medical education disability plan that's available to you while you're in training and as you're leaving training from the Mayo Clinic. If you would go to that website I've mentioned before, www.gmedisabilityplan.com, you'll see a tremendous amount of information about this program. Some highlights: your acceptance is guaranteed, is what's called a guarantee issue plan. Very unique opportunity, and it allows you to avoid underwriting, which again, if you saw part one of the series, you have a little bit more information about. You have increases available to you when you leave and join practice as your income grows. You're guaranteed to be able to purchase more coverage to protect that income regardless of your health changes. That's significant. You have discounted rates now today, and they're gender neutral rates, so men and women pay the same. And those discounted rates continue even after you've left and joined another practice or doing some form of work in the future. Those rates continue to be discounted, continue to be gender neutral. This will save you a tremendous amount of money as your career progresses. You have your own specialty definitions of disability, very similar to what you saw earlier in this presentation. Cost of living increases when your claim lasts for many years, so you don't have to live on a fixed income. There's much, much more here. Take some time, go to that website, find out more about this program. You must take advantage of this prior to or during the time you're graduating and leaving your training, so don't delay. Spend a few minutes and see if this is a good option for you to protect your income. Last, we have a gift for you. If you saw our first webinar, we mentioned this. Dr. Vicki Rackner is a former surgeon and now a consultant who works with physicians to help them build successful practices. On our homepage at gmedisabilityplan.com, there's a slider of about 4 or 5 slides that go across the homepage. That last slider is what you see to the right of your screen. Click the View eBook and you can actually download it from there. But Dr. Rackner has allowed us to provide this to you free of charge. It's entitled Get More Patients Starting Today, and offers a lot of great ideas about how you can build your practice as you leave training and head out into whatever endeavor you are moving forward to tackle. So with that, if you have questions, again, please go to the website. There's an opportunity for you to submit questions. We will promptly respond. And I've enjoyed my time with you today. Thank you so much for listening, and all the best.